Welcome to This Explainer. Today, we're diving into a real medical detective story, focusing on a vital but frankly super misunderstood part of our dog's health, their kidneys. If you've ever stared at your dog's blood work report and just felt totally overwhelmed by the alphabet soup of acronyms, you are absolutely in the right place. We're going to decode the science, strip away that confusing medical jargon, and look at exactly how modern vet medicine is totally revolutionizing the way we spot kidney issues well before it's too late. Section 1. The silent kidney threat. So kidney disease is this incredibly common, yet completely silent threat that affects up to 20% of our dogs and cats. And for a lot of pet parents, hearing about it just leads to sheer panic. Okay, let's dive into this. For decades, the second a vet said the words renal failure, it felt like an immediate, unavoidable death sentence for a beloved dog. I mean, it paints this grim picture of organs just completely shutting down, right? Leaving zero hope for management. But as we're going to see, modern science has totally flipped this narrative on its head.
Section 2. Redefining renal failure.
That terrifying old term, renal failure, it's actually considered super outdated in modern vet medicine now, mostly because it just lacked any real nuance. Lumping all kidney problems under the massive umbrella of failure wasn't just scary, it was medically inaccurate. Today, the medical community breaks it down into two distinct categories. First up, we've got acute kidney injury, or AKI. This is a sudden drop in the kidney's filtration rate. Often you'll see reduced urine output. But the key here is that with timely intervention, it can sometimes be completely reversible. On the flip side, we have chronic kidney disease, or CKD. Now this is characterized by long-standing structural or functional abnormalities that hang around for 2 months or more. CKD is generally progressive, sure, but as we're about to learn, catching it early, that changes absolutely everything.
Section 3. The traditional, late alarms.
To really grasp why late detection is so dangerous, we have to look at the kidney's filtration factory, medically known as the glomerular filtration rate, or GFR. GFR is basically just the speed and efficiency of how well the kidneys clear waste from the blood. Traditionally, vets measured this using markers like creatinine and blood urea nitrogen, but the glaring issue with these older tests is their lack of sensitivity. Which brings us to a frankly staggering number, 75%. These traditional markers usually don't ring the alarm or spike in the bloodstream until an astonishing 75 to 90% of the kidney's functional mass is already gone. Think about that. By the time the alarm finally goes off, the fire has already burned down most of the building.
And honestly, the massive delay in detection isn't even their only flaw. These traditional clues can be incredibly misleading. Take creatinine. It's heavily impacted by a dog's lean body mass. So if you've got an older, frail dog who's losing muscle, their creatinine levels might actually look artificially low, totally masking a severe kidney issue. Meanwhile, BUN can be falsely elevated by things completely unrelated to kidney function. We're talking a high-protein meal, a gastrointestinal bleed, or even liver disease. At the end of the day, they're just unreliable witnesses.
Section 4. Enter the early detectives.
So this massive blind spot, literally waiting until 3/4 of the kidney is destroyed to make a diagnosis, that drove the veterinary world to hunt for novel biomarkers. Now, doing a direct GFR clearance test is still the absolute gold standard for accuracy. But let's be real, it's labor-intensive, time-consuming, and super expensive. It's just not practical for your routine vet visit. So instead, scientists developed these new, highly sensitive early detectives. We're talking simple blood markers that closely mimic that direct GFR accuracy, all from just a standard, quick blood draw.
Enter the real hero of modern kidney diagnostics, SDMA, or symmetric dimethylarginine. SDMA is a total game changer because it starts to increase when, on average, only 40% of kidney function is lost. Just let that difference sink in for a second. We go from waiting for 75% destruction with creatinine to catching the damage at just 40% with SDMA. It literally gives us a massive head start for treatment. And this brilliantly illustrates exactly why SDMA is so vastly superior, especially for our older, frail dogs. Unlike creatinine, SDMA is an endogenous surrogate marker that is completely unaffected by poor body condition or lean muscle wasting. So it genuinely doesn't matter if your dog is an elite canine athlete or an underweight senior. SDMA gives a crystal clear, unclouded window into exactly how well that kidney is filtering. But hey,
SDMA isn't working the case alone. Science has handed us another brilliant early detective called cystatin C. This is a low molecular weight protein that usually passes right through a healthy glomerular membrane without a hitch. But when that kidney filtration factory starts to slow down, cystatin C builds up significantly in both the blood serum and the urine. Studies are showing it's a highly sensitive early indicator, and it elevates well before those traditional late-stage markers ever do.
Section 5. Staging the disease.
Once our veterinary detectives use these early biomarkers to confirm there's an issue, they need a precise map of the damage. Because it's really not enough to just say, hey, your dog has chronic kidney disease. Now, what's really interesting about this slide is how the International Renal Interest Society, or IRIS, has created these highly organized, universally accepted guidelines. They map out chronic kidney disease all the way from stage 1, which is very mild, right up to stage 4, which is severe. Following a diagnosis, vets look at stable readings of both SDMA and creatinine to officially place a dog into one of these 4 distinct stages.
And it doesn't stop there. This actually builds into an even more personalized treatment plan through what's called substaging. So once the primary stage is locked in, vets will check the dog's systemic arterial blood pressure, basically mapping if they're normotensive or severely hypertensive. After that, they measure the urine protein to creatinine ratio, or UPC. If a dog's UPC is greater than 0.5, they are officially leaking significant protein into their urine, and that is a major red flag that dictates very specific medical interventions moving forward.
Section 6. The future of diagnostics.
As absolutely incredible as SDMA and cystatin C are, veterinary science is already pushing boundaries. We're moving from just asking, is the kidney failing, to pinpointing exactly which microscopic part is crying out for help. If you think about the structure of a nephron, which is the functional unit of the kidney, it has 2 main parts. You've got the glomerulus, acting as the filter, and the tubules, which process that filtered fluid. Our current hero markers, like SDMA, are fantastic at telling us that the general glomerular filtration rate is down. But what if the damage is happening exclusively in the tubules, say from a sudden toxin or an infection? Well, that is exactly where the next generation of biomarkers comes into play. Emerging urine markers like NGAL and GGT act as highly specific microscopic detectives. Instead of just giving us a general filtration is down warning, these markers can actually pinpoint exact primary tubular damage. Plus, blood markers like FGF23 are currently being studied to detect altered renal metabolism. So in the near future, running a panel of these specific markers is going to give vets a comprehensive, high-definition map of a dog's exact renal health. It's truly mind-blowing stuff. All of this incredible science really brings us to one final powerful thought. By finally moving away from that terrifying, outdated concept of renal failure and embracing these early, hypersensitive diagnostic biomarkers like SDMA, we are catching kidney disease when there is actually still time to act. With these early warnings giving us a clear window into the kidney long before 75% of it is destroyed, we have to ask ourselves, are we entering an era of veterinary medicine where a chronic kidney diagnosis simply means a new, manageable chapter of life, rather than a terminal end for our best friends? Looking at the data, the science certainly points to yes. Thanks for joining me for this explainer, and I'll see you in the next one.